Welcome back. Well, yes, indeed. It is the International Day Against Drug Abuse and Legal Trafficking. How do we draw attention to this? There's a huge challenge about this. Now we've been joined by Dr. Ogbonnaya Ndupu, who is a consultant psychiatrist, addiction specialist at Life Crest Rehabilitation Center. Thank you for coming on this morning.
Thank you for having me.
Well, it turns out that, well, most times, if we don't have this kind of days, well, you may not get the kind of focus that it requires. But we know that so much is going on behind the scene. Give us a picture. How serious is this drug abuse challenge?
Okay, let's talk a bit about the UNODC report that was released in 2008, was done the previous year. It says that at that time, we have about 14.3, almost over 14 million people who have abused drug in the previous year. So if you compare that to 2016, it has almost tripled. In 2016, we had a prevalence of about 5.6%. Then now, that means between 2017, it had tripled. And of these people would say, if you see 5 people abusing substance, 1 is a woman.
Why is that?
We're having increased cases. In the past, it was about 1 in 7. But now, women also are tending towards drug addiction and drug abuse. And of these people, when we say people who have used substance the previous year, so we are more like saying fresh cases included. We're not even talking about ongoing cases, chronic cases that had been on drugs for 4 or 5 years. You understand what I mean? And we know that of these people, 1 in 5 have developed a substance use disorder. Substance use disorder may vary from dependence, inability to stop the substance, unable to function. You are not being productive, you had dropped out from work, you have dropped out from school. That's a drug use problem. Or even back in your immediate environment, your home, you're not living up to your responsibilities. Or for some people, they may have developed what we call complications from drug use, other psychiatric problems.
Yeah, but from your experience, what are some of the causative factors to drug abuse?
I will still say on the top of the list for us, we know there's this thing about the media, the pop culture, people wanting to experiment. It seems the desire to experiment outweighs the cry for awareness, drug education, which I don't think we are doing enough of that. Because from the statistics we have, we know that majority of people, when we say we have 14.6 million, we mean that people aged between 15 and 64. Understand this age bracket. In that group, between 15 and 64 years, we had the highest numbers between people 25 to 30. So think, where do you find these people? Universities, about that age. So they are still the same people who are exposed to experimentation.
So, in terms of how the country is responding to this challenge, how would you rank it? Do we have the facilities there, the personnel? Are we making any progress?
I think we are still making baby steps. What are the challenges we have identified with drug addiction and drug abuse? One, I would say first the issue of stigma. People are afraid to come out and say, I think I have a drug problem. I think I need help. Even relatives have turned the other way because of stigma. Beyond stigma, how many facilities do we have? Just a handful. If you look at the tertiary centers, which are too few to even handle this, we have private settings, and then we have a few others that try to help, but really not doing the proper thing. So we've talked about the stigma, we've talked about availability of these centers, and those that are even available, what kind of services are they given? Very recently, we're not having the challenges of having female drug users. We don't have facilities for them. When you have female drug users, there are things we need to expect. We need to consider their health, their sexuality. We see them coming pregnant. We see them coming with children. We do not even have those facilities that holistically cater for those people, knowing that, oh, this woman we have picked from the street, this drug user, she may be HIV positive. This same drug user may be pregnant, unprotected sexual intercourse may have occurred in the process of using drugs. There's a risk of having a child who may also have issues. Right. We do not have facilities to cater for this at all.
We'll come back to this in just a moment. Stay with us. Welcome back.
Yes, madam, I hear prevention is better than cure. We've talked about the move to treat it, to care for it, but the availability of the product makes people vulnerable to use. Is there any way of controlling access or availability of these drugs? You know, I mean, given the fact that some are even talking about producing more of some of these things, marijuana and the rest of it.
Yes, that brings us to the issue of what we'll call supply reduction and demand reduction. We need to, which is the role of the law enforcement, the NDLEA and the likes, to address this. Because another factor to, in answering Chamberlain's earlier question, why is this now, is access and availability. From the use of prescription medications, opioids, up to the use of cannabis. It's more accessible. There's a lot more in the streets than we know. And so that's the work of the law enforcement agency, to try and restrict and control the use. At the same time, we need to be careful. You know, we keep emphasizing decriminalizing the use. We need to learn to draw a balance between, rather than criminalize someone who is a user, we should be able, our system should be able to encourage them to seek help, because at that point there is a problem.
Part of what was said in that report is that those who, I think they say illegal use, that we should do something about ensuring that they actually are allowed to use it, those who really need it, and not just people who want to use it as a recreation. How do you see that playing out?
That will be a bit difficult in this part of the world. How are you able to draw the line between those who you say genuinely need?
If you prescribe that certain persons must use certain drugs medically, and the law doesn't allow usage of those drugs, isn't that going to put your patients in a fix?
Yes, but you know, it still boils down to striking the balance. Take, for instance, the opioids, the prescription opioids like the codeine. The last time this issue came to the fore, they talked about NAFDAC stepping in, trying to, regulatory bodies ensuring that you do not sell these drugs without prescription and all that. To an extent, but people still have, Nigeria with what it is, people still have the way they go behind and get these things. So it's a bit...
When you say behind,
yeah.
Are these produced in Nigeria? Are they smuggled into Nigeria? Or is Nigeria just a transit country that it happens to just get inside and then somehow just gets missing and then infiltrates into society?
I would say yes to the three things you have said. Some are produced in Nigeria, some transit. Nigeria is a transit point for some of those substances, the cocaine and the rest. So in the process of being transported from point A to point B, they pass through here and they get access to the public. Marijuana, we know it's been grown, and then people use them for other recreational purposes. So those three factors still apply in this country.
So if they do, then what should the government or legislation, what role should legislation play in this instance? Because if you, going by your statistics, we have a minimum of between the ages of 16 and 65. 64. In one way or the other, having this drug challenge, what must the legislators do with a view to finding how these drugs come into the country from the source country and try to stop it from that point?
What must they do? They need to, you know, in the course of having to deal with drug issues, there needs to be more like a collaboration between caregivers and law enforcement agents. Because for us as therapists, somehow we are able to get information of how these clients get the substances. So if this information are made known to the law enforcement agents, they could try to address this issue of it being trafficked.
Is there a collaboration between professionals like yourself?
There isn't. I'm not even aware of any. There isn't.
Wow.
Is this one of the things we have, because you remember that since 1980, this whole issue of Nigeria being a transit country started in 1985, but clearly we have left so many things, as early as the 80s, clearly we have left so many things undone. If this collaboration is lacking, how much at risk are we, given that 14.3 million people are said to be, in that net now? How much at risk are we?
If it has tripled in 1 year, let's say what would happen in 2020, 2021. Because if we don't begin to do something very drastic, as in addressing this issue of drug use.
But the windows are not closed. I mean,
the windows are not closed.
I mean, the windows between you and the authorities, just so that relationship to be able to curb all of this is established, and then we're making sure that we don't have higher figures, but inside either steady or declining figures. What would you do when you leave the studio, for instance, now? Since we've identified that it doesn't exist, that relationship doesn't exist, what will you do to establish it, to start it up?
For one, we are willing to work with law enforcement agents. For us as therapists, as addiction specialists, we are not happy that 6 months from now, the same client comes back to our facility, what you have just thought you have handled. We are willing, if these people are also willing on their part, to reach out and say, you know what, we think you can anonymously give information on how do we block these things out there in the streets. You asked the question earlier, sorry, we just got derailed a bit from that. You talked about prevention. Prevention for us is twofold. Prevention now, we are trying to preach against, don't even start the use of the drugs. That's one aspect of prevention. The second aspect of prevention is, as much as possible, we are trying to delay the onset. And then prevention for someone who may have been exposed to drug use, we are now preaching, you need to cut down, you need to reduce your use of this substance. Because 3 years from now, you may have developed addiction to it. A substance you think you are casually using may become a problem. So that's, at those levels, we should be tackling the problem of prevention when it comes to drug use.
Education is then very, very important.
Yes, which also goes back to the family. Because we know with drug use, there is a very important role of family. We know that there's a lot of family dysfunction going on before people begin to abuse drugs. So while we also go back to grassroots and begin to educate families, how do we prevent? How do we start talking to our kids early in life? Do not wait. A lot of these substances, the age of onset is 19. So you have an idea what a 19-year-old, late adolescent, this chap is almost getting to the university, should be in the university, just leaving secondary school. At that level, we should have started this talk on drug education. The same way we have talks on sexuality in school. I don't see why this should not be part of our curriculum. That's a way to prevent this, that children become aware. You don't, from the classrooms, you know the adverse effect of drugs. You do not wait until your friend introduces you to codeine or to marijuana, because these days they don't even smoke them. I hear that it's in cookies, is in all sorts, muffins.
We need to wrap up. Yeah. My apologies, just this one before we go. Now, tell me, you mentioned, just to pick up what you said earlier about society being harsh on people, not accommodating them. Sometimes it's difficult for people to come out. How? Because people fear what they don't understand. If society feels that, look, I'm not sure how this person's status is, so sometimes they're a little apprehensive. How should society respond? How can we help to ensure that your work is a lot easier, and then we'll have a lot more people who don't use these drugs?
Okay. How society can respond is awareness, people having information, people knowing what the substances are, what are the early signs of use of substance. Because if you live with a young chap and you're clueless, you may never know until things have really gone down and he's not functioning, he's coming to work late. So if people are informed and they know that this may be signs of drug abuse, early they're able to speak up and seek help. And we are against people criminalizing these individuals. Like I said before, let's come from a place of love, that this person actually needs help. I heard someone talk about the issue of denial. Sometimes people deny because they don't even know they're deep in it. But they live with family members, they work with colleagues, who have seen that there is something going on somewhere. And we think you need to seek help. So if we come from that angle where we are able to listen. Last year, the theme for the World Drug Day was listening to the children. Listen first, with emphasis on the family, being there to hear these kids out.
Well, clearly a job of work that we all have to do. We appreciate your coming on. Dr. Ogbonnaya Ndupu is a consultant psychiatrist, addiction specialist at Life Crest Rehabilitation Center. We wish you all the best.
Thank you very much.